Hi, my name's Dr. Jyoti Rao. I'm here to talk to you today about what we can do about chronic illness. And a lot of these tools and tips come from our book called Body on Fire, co-authored with Dr. Monica Agarwal. It's available on Amazon, so please check it out for more details. So what are some of the things we can do if we have chronic illness, if we have symptoms that can lead to chronic illness? So remember, you don't just wake up one day with high blood pressure or diabetes or cancer. These are things that kind of brew in our body, that kind of start with a process of inflammation that is due to the separation of things that are related to our resources and our stressors, which I've talked about in a previous video. When we have more stressors than our resources, we start to get inflamed. When we have a higher sympathetic drive, when we're in fight or flight mode longer than we are in rest and digest, we start to get inflamed. And that inflammation can cause symptoms like fatigue, back pain, rashes, headaches, GI disturbance, bladder infections, things that are outside of our gut can cause symptoms anywhere in the body, including mental stress, anxiety, depression. So our job is to be aware that these things are breaking down and act on them. If you don't act on the symptoms, they turn into things like abnormal lab tests, which can then turn into disease states like hypertension, heart disease, high blood pressure, things like that. So we have a whole spectrum of time where we can catch things based on our symptoms and how we feel. That's what we want to work on. What do we do about that? Well, the first thing you want to do is support your immune system, work with your lifestyle, do things that are going to support the nutrients. 80% of our immune system's in the gut, so our diet matters. Whole food, plant-based diets, lots of fiber, lots of fruits and vegetables, grains, seeds, nuts. Load them up on your diets and try to see, you'll see things change, because dietary changes our gut microbiome, which changes our immune system, which turns off inflammation when we're eating the right type of foods. The second thing you can do is sleep well, prioritize your sleep, work on mind body, start thinking about relaxation techniques, which I'll get to in another video. Some of the stuff that we do at Shakthi to help people calm down the mind and support the mind-body connection. Movement, like I said, having a positive attitude. And we can also use interventions in addition to lifestyle to help us with talking about things like physical therapy, chiropractic, Reiki, acupuncture, energy medicine, tapping. All of these are interventions we can use to change our symptoms. We can also use herbs and supplements as a bridge to help us to get to a different state. And there is absolutely nothing wrong with using medications when we need, and also surgeries or procedures when we need them. Remember, nothing is absolutely right or wrong. What we all want to do is incorporate all of these interventions. Sometimes I get patients who feel like they get very upset when they have to rely on some meds because their lifestyle wasn't enough or their other interventions wasn't enough, and it's okay. Medications are not wrong. They're also part of the spectrum. So let me give you an example. If you had someone who comes in who has sugars in the 250s, we must use meds in order to keep that person in a safe place so they don't have injury to their blood vessels and their brain and their heart and their vision. Until we can get those numbers or sugar numbers down, we cannot take people off of medications, and medications are not wrong. So I want to kind of stress the fact that all of these are completely fine interventions and we can use a combination of them. But I want to rely on lifestyle first, and maybe other type of interventions like supporting our vagal system through things like acupuncture and Reiki and energy medicine and maybe physical therapy and those kind of things, in addition to medications and other procedures and surgeries. I hope that was helpful. Thanks for watching.